Hi everybody, this is Dr. Jamie Marich, and today we're going to be working with breath work using counting variations. A lot of people who struggle with staying in the present moment as they practice breathing do find that having some kind of count to be able to hold on to helps them to stay more focused on the breath at hand, on the task at hand, as opposed to allowing the thoughts to drift off. So I'm going to give you a couple ideas here on how to use counting really with any breath that you may choose, the diaphragmatic, the complete, the ujjayi breathing. So, one variation I very recently learned, actually from a student of mine, which is something I love because when students teach me things, to me that's what it's all about, is you can think of doing this. And I'm going to use just kind of the standard diaphragmatic breathing first for the demonstration. So, you inhale one, exhale one, inhale two, exhale two. Inhale 3, exhale 3. And then when you get to 10, inhale 10, exhale 10. Then you can go back and start at 1. Inhale 1, exhale 1. Inhale 2, exhale 2. And what I really like about this technique is that it keeps you from like having a contest with yourself. Because I know sometimes if I get into counting breath, it's like, oh, I got as high as 21 that time, or I got as high as 35 that time. It's not about a contest, so to speak, of how long can you stay concentrated on your breath. So that's why I like that commitment of every time you hit 10 to then come back to 1. So know that that is a plausible counting variation you can try with your breath. What I do a lot with clients is I start with a 4-2-6 count. So meaning inhale for 4, hold for 2, exhale for 6. And then from there, we can kind of tailor the count to see maybe if 4-4-4 is better for you, 4-4-8, 4-2-8, because different people tend to have different preferences on inhales and exhales. So let's try 3 sets of 4-2-6 together, and then just see where we go with this. So using the diaphragmatic breath, inhale, 2, 3, 4, hold, 2, exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4, hold, 2, exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4, hold, 2, exhale, 2, 3, 4, 5, 6. So just check in with your body, notice how it feels after taking that breath. So here's another very popular one. This is often called square breathing, which is 4-4-4. So let's give this one an attempt to see if this one is any more agreeable. Maybe you notice it's neutral. Just let's see what you notice about it. So I'm going to inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4. Let's do one more set. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, 5, 6. Oh, I went a little far on that one. So just exhale, 2, 3, 4. So taking a moment just to check in and notice. And here's something I've learned about counting with breathing. You will hear different teachers, different doctors out there giving you their strict opinions about which count they think is best for whichever reasons. That's all well and good. What I always advise people I work with, though, is you have to find what works for you. So if maybe on one day 444 feels like it gets you into a better rhythm, that's fine. If on another day doing that in one out one helps you a little better, that's fine too. So really play around with this, experiment. One little tip I have picked up over the years is that if you're working with more of an anxiety condition, generally it's better to aim for longer exhales. If you're dealing with more of a depressed mood state, typically longer inhales on the count do tend to serve you better. But if at any time you notice that it doesn't seem to be working that way, or if you're getting an uncomfortable lightheadedness, I've traditionally found that lightheadedness with breath is because the exhales aren't long enough. So that just might be something that you want to notice if that comes up in your practice. So know that these breath counting variations are here at your disposal with any of the breath practices that we have done thus far in this series. This is Dr. Jamie Marich reminding you to be well.